two male Singapore residents on board a cruise ship that was hit by an outbreak of the Andes hantavirus are now in quarantine at the National Centre for Infectious Diseases. As of Wednesday, 8 cases, including 3 deaths, have been linked to the MV Hondius. Singapore's Communicable Diseases Agency was notified of the duo's presence on the ship. The two men, a 67-year-old Singaporean and a 65-year-old permanent resident, were on board the ship when it departed Argentina on 1st April. Now, according to CDA, they're being tested for the disease and results are pending. One has a runny nose but is otherwise well. The other has shown no symptoms so far. If the results come back negative, both men will be quarantined for 30 days from the date of their last exposure and will be retested before they are released. One doctor says the current risk to the general public in Singapore is low.
They'll be isolated for something like 30 days, and that will be quite safe, well over the average incubation period, which is something like 14 to 17 days. So 30 days really give it a margin of safety. Then they'll be tested before they are released from quarantine, and they'll be tested after through phone surveillance. So I think the full suite of measures are taken, and Singapore is quite safe.
Now, the cruise ship at the heart of the suspected hantavirus outbreak is now headed to Spain's Canary Islands after being anchored for 3 days near Cape Verde. Nearly 150 people from over 20 countries are on board the MV Hondius. Now, let's take a look at where it's been. Originally bound for Antarctica, MV Hondius first set sail from Ushuaia, a city in Argentina, commonly known as the world's southernmost location. Just over a week later, the first passenger dies. And as the outbreak worsens, MV Hondius requests to dock at Cape Verde, but is denied. As of 7 p.m., the ship is off the coast of West Africa. The first death reported on board is a Dutch man who passed away on 11th April. His body is taken off the ship 2 weeks after his death. At this time, some passengers have started disembarking, including the Dutchman's wife. She flies to South Africa and later dies in a hospital there. Now, on 2nd May, a German woman dies while still on board the ship. This brings the total number of deaths from the suspected outbreak to 3. And let's take a closer look at what hantavirus is and how it spreads. The virus is primarily carried by rodents, and people typically get infected when the virus in rodent droppings, saliva, or urine become airborne. The WHO says people-to-people transmission can happen, but rarely. Hantavirus can cause 2 types of illnesses, one that attacks the kidneys and the more severe form affecting the lungs, known as hantavirus pulmonary syndrome. That has a high fatality rate of about 40%. Initial symptoms can be similar to flu, such as fatigue and fever, making early diagnosis difficult. Later, the infected person may start coughing and suffer shortness of breath. There is no specific treatment for this infection, and doctors generally focus on supportive care, including rest and fluids. Some patients may require breathing support, such as a ventilator. Now, prevention mainly involves eliminating rodent infestations. Areas with rodent activity should be cleaned carefully. Avoid vacuuming or sweeping, as that can stir up particles and make the virus airborne. So let's talk to an expert for more now. We have Prof. Su Liang, who is the director of the Asia Center for Health Security at the NUS Saw Swee Hock School of Public Health. And Prof, good to have you with us. As we know, the 2 male Singapore residents have been linked to the Andes hantavirus outbreak. But if both residents test negative, why will they still be quarantined and monitored?
Thanks for having me with you. We know that during the incubation period, which can take up to 6 weeks, people will test negative because the virus doesn't shed. So it's still important to monitor them closely and test them for the full duration of the incubation period.
Now, how concerned should we be then that the 2 Singapore residents were on the same cruise and flight as a confirmed case who then later died?
I think you've given a very good summary. So this is a virus that doesn't spread easily between people, usually only when there is close physical contact or when a healthcare worker is caring for an infected individual without protection. But cruise ships are kind of a confined environment where the risk of transmission is higher. I read that the MV Hondius is one of these polar explorers, and there are only about 150 persons on board. So I guess the risk really depends on how much contact our two residents had with those who had come down with the disease.
Yeah.
On the flight, I don't think that's an issue.
And we know that one individual as well has a runny nose. That sounds like quite an ordinary symptom. But what more serious symptoms would doctors be watching out for?
You're right, and actually you gave quite a good summary earlier. So the early symptoms are a little bit like flu. They will have fever, muscle aches, and then some will have stomach ache and have diarrhea. So it's almost like a gastric flu. And the more severe manifestations only come on maybe about a week or so, 4 days to 10 days after this initial period.
Well, how does Singapore's past experience with rare hantavirus cases or even rodent-borne strains locally, how does that affect the way we assess our preparedness for a potential outbreak?
It came as a surprise to me many years ago to learn that about a quarter or third of the rats in Singapore actually had evidence of hantavirus infection. But this is a different type of hantavirus compared to the Andes virus. These are much less deadly, and they cause at most the renal or the kidney disease that you mentioned. However, symptomatic cases, as you mentioned again, are very rare, maybe a couple every decade or so. I think it's because hygiene standards are high in Singapore, and almost all of us are not exposed to rodents to the point where we easily contract pathogens from them, including the hantavirus.
So what is the actual risk to Singaporeans at this point? Authorities are saying that the public risk is low. Do you agree with that assessment?
Yes, of course. The people working at the Communicable Diseases Agency are some of my colleagues, and they are experts. And I agree with them that the public risk is very negligible, even if one or both of the residents are unfortunate enough to be harboring the Andes hantavirus at this point in time.
Since it's the Andes hantavirus, is the main concern here rodent exposure, or is it the possibility of human-to-human transmission as well?
I think in Singapore, there would be no risk of contracting the Andes virus from rodents. So the concern is human to human. But as I mentioned, this is only under circumstances of prolonged contacts. And both of these individuals are now at the National Center for Infectious Disease.
So before we go, how do hantavirus symptoms compare against other respiratory illnesses like COVID-19, SARS, or even the flu, for example?
That's a very good question. And I think that the initial symptoms are quite similar in the sense that there's fever and muscle aches. So actually, this is quite similar to lots of different infections, and it's hard to tell them apart. But I guess the Andes virus infections progress in a different way from COVID. They're certainly much more deadly. In the outbreaks in the Americas, between a third to half of the patients who contracted them have died. So that's certainly a far higher risk of a worse outcome compared to flu or COVID.
Professor, thank you so much for sharing your insights with us. That was Prof. Su Liang from NUS.